You're at the exam hall and you're stuck between two answer options. Answer A is osteoarthritis and answer B is rheumatoid arthritis. How do you tell them apart? Both patients will present with pain and stiffness in their joints. That's the general complaint. But there are nuances that you have to recognize to tell them apart. If you look at the joint space has a synovial membrane that lines the inside of the joint. This membrane's job is to lubricate the joint space. There is also a hyaline cartilage and articular cartilage that acts as a normal cushion between the two articulating bones in the joint. So in rheumatoid arthritis, there is an inflammatory infiltration of this synovial membrane that produces B-cell lymphocytes, which produce anti-CCB antibodies. These antibodies attack the synovial membrane, causes inflammatory degeneration. These patients will probably be females, middle-aged, 40 to 50 years old. They will complain of pain and stiffness in their small joints, like their fingers and their toes, that is worse at the start, upon waking up, at the start of the morning, and eases with activity. The stiffness is longer than 1 hour. This is key. These patients can also present with a unilateral large joint pain and tenderness. The joint will be inflamed, and these patients will have a high fever. You have to think about septic arthritis, because remember, these patients are on long-term immune suppression, like corticosteroids or methotrexate or infliximab. So they are severely immune compromised and they are susceptible to sepsis, septic arthritis, and opportunistic infection. Now let's switch gears and talk about osteoarthritis. On osteoarthritis, this is a primarily degenerative wear and tear condition. So it naturally affects people at the end of their lives, old people, obese people, and people who never exercise a day in their life. These patients will complain of pain and stiffness in their large joints. It will be symmetrical because they are obese on both sides of their body. And crucially, these patients will have problems in their distal interphalangeal joints, this joint. Because rheumatoid arthritis has only problems in the metacarpophalangeal joint and the proximal interphalangeal joint. So this is a very telling clinical exam sign to differentiate between both conditions. First-line treatment of osteoarthritis are NSAIDs and acetaminophen. And these patients, generally, you can't reverse the problem. It will keep getting worse. You just treat symptomatically.